they have the service, they have the installation, and they have the clinical training that is necessary for a successful, happy dental laser owner. And I believe that Biolase has not only the best distributors here in Mexico, but also the best distributors throughout the region and around in our 71 countries around the world.
Okay. We know that you are responsible for the development of Biolase technology. Can you tell us what we can expect from Biolase in the near future?
That's a trick question. Okay, no secrets here. Okay. But what I will share is that it's a responsibility of Biolase, and virtually all the innovations in laser dentistry has come from our company and our R&D team over the years. And what we're striving to do right now is to bring the laser technology into the same level of innovation as we see with a smartphone, a Galaxy or an iPhone, where we're using Wi-Fi and connectivity to the distributor, to the corporation, even to a user group, and as well as the apps and the online training, all of the things we see in modern high-tech world. We're trying to incorporate all of these features and technologies into our lasers.
Okay, perfect. I will check if we have some questions. We have some expressions of good days from Uruguay, from Corina Lacoste, and I don't know, Norma Sanchez. I suppose that she's from Mexico. Say hello.
Hello.
And maybe we wait a little. Vamos a esperar un momento para ver si existe alguna pregunta que podamos tener para Bill en estos instantes. Esperamos o tú tienes por allá en Facebook algo, Dianita.
Únicamente saludos.
Saludos. A ver, saludos. Dinos los saludos.
Tenemos saludos de la doctora Alma Díaz, del doctor Julio César Adams, del doctor Marco Romero.
Only hello.
Yeah, I have many friends in Latin.
Yeah, from Mexico and Latin America.
In Latin America, absolutely, yes.
Doctora Ana Lilia Arce también manda saludos.
Okay.
Doctora Dulce María Joroles, doctora Noemí.
Good morning from Monterrey, from Carlos Quintanilla. And good morning from Latin America, from Giovanni Pozo.
Giovanni Great. Well, hopefully the people that are wishing me a hello this morning will meet us in Cancun in October.
Oh, okay, perfect. And something more? Yeah. Pregunta. We have a question here. The questions are appearing right now. Future is a little bit very near to the last question. In the next future, 10 years, how do you expect the technology in the dental practice will be?
Well, we believe that long term, as lasers become standard of care, the laser technology will be incorporated into the dental unit, just like a high-speed, low-speed, air, water, intraoral camera, scanner, laser. We believe it will just become totally integrated into the dental systems.
Okay. And we have another. How do you think we can introduce the use of the laser in our practice, considering the cost of the device?
Well, one of the things we are working very hard on is bringing the cost down. As I mentioned earlier, the lasers today are much smaller, much less expensive, much more reliable, and much more intuitive than the earlier lasers. But they can be confident that we will continue to make lasers more affordable for our practitioners throughout the world.
Okay.
You're not going to become standard of care unless everything is affordable.
Okay. When we will have a laser or the possibility to allocate a laser in the unit, in the dental unit.
That is exactly one of our biggest projects for long term. It's a little complicated in that there's ADEC, there's Cavo, there's many Plan Maca. There's so many manufacturers of Anthos dental units that there has to be a coordination within the dental unit manufacturers, and they have to become convinced that the laser needs to be built into the dental unit. We will have the technology available as we develop partners within the dental unit community. It will have to be a partnership between the laser manufacturer, the dental unit manufacturers, and then distributors such as Dentadec to have a complete solution for the doctors in the future. Yes.
Perfect. Maybe you answer that is Giovanni Pozo. Maybe if the laser will be more cheapest than is right now. I think that you answered that. It's not any question. ¿Tú tienes preguntas de aquel lado, Dianita?
Y no solamente los saludos.
Good morning, Marcela Rojo de La Vega. Good morning. When and where in Cancun will the seminar take place?
You'll have to answer that.
Yeah. When? I don't remember exactly.
It's the 16th through the 21st of October.
21st of October, Cancún.
Sí,
Todo de la cumbre.
Sí, del 16 al 21 de octubre.
Del 16 al 21 de octubre será la cumbre en Cancún. Ya tenemos hotel.
Sí, Escaret, Gran Escaret.
Gran Escaret. En el Gran Escaret será la cumbre. With Giovanni Pozo will maybe give us another questions. I don't know. Do you have something? ¿Tienes algo por allá, Dianita?
No, no sé si Giovanni puede abrir su micrófono, si tenga el micrófono. Ya está en el panel. Tiene preguntas.
Podemos pensar en tener un láser con más. If we think that we can have a laser with more longitud de onda, with more
wavelengths.
Amplitude.
Okay, yes. Yeah, different wavelengths of lasers perform different functions clinically. And right now, BioLase has two different wavelength lasers, one for soft tissue and pain therapy, one for cutting on the tooth structure without pain. We will see in the future, the application of multi-wavelength lasers. The challenge is the opposite of the questions we've been having today. Multi-wavelength lasers are much more expensive.
More expensive.
Yeah.
Okay.
So, but they're definitely in the future.
Okay, perfect. We don't have any more. ¿Tienes algo más, Dianita?
Tenemos una pregunta que dice, ¿puedo ir a conocer BioLase?
If a dentist want to know the BioLase plant or the BioLase corporation.
Yes.
In place, is possible?
Yes, absolutely. Yeah, we would love to have them come visit us. We can arrange a tour of the factory. In spite of rumors that our lasers are made in China or somewhere else, we actually make all the lasers, even the little handheld pen laser, right there in our factory in Irvine, California.
Okay. Es posible. Entonces, más bien, supongo que tendría que haber algún tipo de relación. Yo diría que contactaran con su distribuidor. No sé si la pregunta viene de México específicamente, pero tendrían que contactar con su distribuidor, bueno, para hacer algún arreglo para que se pueda hacer esa visita en la fábrica de BioLase. ¿Alguna otra pregunta?
No sé.
I don't have any questions here. ¿Tenemos alguna de allá de Facebook?
Sí, acaba de llegar.
Ahora, in your opinion, which dental gadgets are the most important for the dental practice?
The need to be should be radiography, digital radiography as a first step, and intraoral cameras, the things you need from a diagnostic standpoint. Then I believe that lasers are the second most important high-tech device. The lasers will allow you to generate income and create additional patients, and happy patients that will help you afford to buy the other technologies, of which in the future, I think that intraoral scanners and cone beams, where you've got a full 3D view of the mouth as well as the structure in the bone for implantology, I think that will become standard of care. And then long term, the idea of CAD/CAM, where you can scan the mouth, digitally design a crown, and right now you would mill a crown in your own office. That technology is available, but very soon we'll be able to use a 3D printer and literally print a tooth the same color, the same to exactly match, and do it all in an office visit, one office visit in maybe 1 or 2 hours. Yeah.
What is your opinion? He or she, Juan Carlos Trejo. Juan Carlos Trejo. What's your opinion comparing ozone therapy against laser?
If you're talking about like electrosurge as a scalpel versus the laser, there's no comparison. The laser is far more precise, much less thermal damage, and the healing is much faster. Just comparing those two technologies, some of the other technologies that are used, for instance, in treating periodontal disease, those treatments require expensive bone and chemicals, medicines to treat the disease, as well as the use of antibiotics, which is becoming very difficult because of the antibiotic resistant bacteria that's out there. The laser can do the periodontal treatments, the mild periodontitis with just the laser, with no antibiotics, no additional medicines, and much more effective and much faster healing. So if the question's a little bit broad, but in virtually every comparison between the laser approach to treating a dental disease and the traditional, the laser is superior.
Okay. I don't have any more here. ¿Tienes algo por allá? ¿No? I think that, bueno, yo creo que si tienen alguna otra pregunta que les interese acerca de la tecnología láser, acerca de BioLace, escríbanla y nosotros se la vamos a pasar a Bill para que él se las pueda contestar en algún momento. Recuerden, toda esta plática va a ser subtitulada para que se pueda subir a I+D y podamos subirla nosotros a nuestro canal de YouTube en el muy corto plazo y ustedes puedan tener una referencia mucho más clara de todo lo que Bill nos ha mencionado. It has been a pleasure to talk with you, Bill. We appreciate a lot you attend this interview. Do you want to send a final message to the Mexican dentists who are thinking about implementing laser in their practice.
Yeah, first I'd like to say hello to all of my friends throughout Latin America, that especially ones with wishing me good wishes today. I think that Mexico and the Mexican dentists have an opportunity to make a major contribution to the lasers becoming standard of care. They've always been very involved in laser technology on the medical side. We have the opportunity to do the same thing on the dental side. So I encourage all Mexican dentists to embrace the water laser technology, and they'll be very happy that they did, and their patients will be even happier.
Perfect. A last question, but that is very interesting. Laser will replace the drill?
No.
Okay.
It's interesting. In very early in lasers in dentistry, that there was a lot of claims that the laser could replace the drill. The laser cannot cut metal. At least the lasers that we use in dentistry are not able to cut metal, and people have metal in their teeth, amalgam and things like that. What the laser does, it replaces many procedures done by the drill, such as cavity preparations. It replaces the scalpel in virtually every application used by the scalpel. And in many cases, the patient will only need topical anesthetic, so it can replace the use of the needle. So it's a much more varied device. So not specifically to replace the drill or the scalpel or the needle, but a combination of, for the majority of procedures, it can replace all three.
Okay, perfect. Thanks a lot, Bill. It's a pleasure.
Thank you.
And, bueno, pues muchas gracias a todos nuestros odontonautas. Esperamos que esta plática haya sido muy interesante para ustedes como lo fue para nosotros al hacerla aquí. Y bueno, pues los esperamos para el próximo webinar que nosotros estemos patrocinando en la plataforma de I+D. Muchas gracias.
Agradecemos mucho a nuestros queridos amigos de Dentadec. Muchísimas gracias, licenciado Ricardo Cárdenas, por esta interesante información. Les recordamos, queridos odontonautas, que con su conexión en la plataforma se acredita directamente su CADI, y a quienes nos siguen vía Facebook les pedimos por favor ingresar a www.inteligenciadental.com/CADI. Fue un verdadero placer recibirles el día de hoy en esta su aula virtual I+D en el ciberespacio. Les agradecemos mucho su tiempo, confianza y preferencia. Nos encantará encontrarles próximamente en esta su aula virtual para que disfruten de las interesantes conferencias que tendremos en vivo. Se despide su amiga Diana Montoya. Que tengan una excelente tarde.